morning, and thanks to Emmet and the committee for having us here. We're excited to be. I am an employee and a shareholder of Alkahest, that's my disclosure, and I would love to tell you about our premise and our programs. So Alkahest is a company based on neurodegenerative and diseases of aging, and our premise is that if we mine the plasma proteome, we can see the differences in the plasma proteome from when we are 18 to 66. You can see on this graph on the left that you have proteins that both increase with age and proteins that decrease with age. Unfortunately, as you imagine, the ones that go up tend to be detrimental. The ones that go down tend to be beneficial. So our approach is to either antagonize those detrimental proteins or to supplement the beneficial chronokines. We call them chronokines. These are both proteins of biological benefit and those that change with age. I'm going to talk to you a little bit today about ALK4290, which is one of the proteins that is detrimental or increasing with age, and it targets Eotaxin. This scientific platform has given us a broad pipeline. Our lead agent, as I mentioned, 4290, both called Alkahest, and you'll have seen the trials labeled ALK4290. Our lead program there is in wet AMD. We also have programs in Parkinson's and some other phase 2s that we're starting soon. Additionally, we have 2 plasma fractions that we're testing in neurodegenerative diseases and cognitive indications, and a broad platform beyond that. So why is ALK4290 important? Well, it's targeting Eotaxin as the ligand and CCR3, which is the receptor, and they're both highly expressed in CNV and choroidal epithelial cells, as well as in the circulation of AMD patients. The combination of these two causes the downstream effect of membrane permeability degradation, immune cell recruitment, and cytokine upregulation, which then leads to a heightened neuroinflammatory state and neovascularization as well. There's crosstalk between CCR3 and VEGF, which we think is important and will be important for our development program as we move forward. I can show you here 2 pieces of preclinical evidence. So we found that the ALK4290 molecule both removes or reduces inflammatory cytokines in aged mice, and you can also see that it has an impact of reducing inflammation in the hippocampus. This led us to move into human trials. We have completed 2 phase 2A studies, Alkahest 4290 201 and 202, and that is in naive and refractory AMD. They're both open-label phase 2A trials with a BID oral treatment. Monotherapy Alkahest 4290 alone, no anti-VEGF. Endpoints BCVA and safety with exploratory, morphological, and biomarker endpoints as well. The results of this study were shown first this year in March at Retina World, and I'll just go over them briefly again here. You can see that 83% of our subjects received either a benefit or a maintenance of visual acuity over the 6-week treatment. And again, this is only 6 weeks treatment as a monotherapy with a 7-letter average gain. Importantly, you can see that 55% had over 5-letter gain, and they had a more significant or meaningful mean change. And then, of course, we had 21% 15-letter gainers, again, over 6 weeks with the oral monotherapy. And this is in naive patients. When we look at the RPE detachment height, we saw a meaningful increase there, decrease of 79 microns, and we saw maintenance of CST. We're interested in seeing what happens with CST with both longer duration and using anti-VEGF as a complement to this program. You can see here that we had a slow and steady increase, as we were hoping for, of the BCVA over the weeks of treatment, and with a 7-letter ending gain. You can also see that we have a decline after the removal of treatment. This is a curve which we see similar improvement in our morphological endpoints, where once you remove the drug, the situation worsens for the patients. This is just another view of that BCVA gain by patient and by subject. You can see the variation. And some images from select responders and morphological changes. When we looked at safety, this was encouraging to us, of course, using an oral molecule systemically for AMD. We want to make sure it's safe. We had no serious SAEs, And we had no serious AEs at all leading to discontinuation of the program. This was 56 patients across the pooled 2A safety results. Importantly, we've had over 200 patients exposed to this molecule with similar results, no serious AEs. So conclusions for us is that we're excited that 4290 may be a safe and well-tolerated oral with profound impact for AMD patients and beyond in retinal therapies, with 83% maintenance or improvement in BCVA. If you're interested in seeing the refractory results, Michael Stewart will be presenting those this weekend, Saturday morning, 11/17. Next up for us are trials to understand how this agent would work with anti-VEGF. We'll be using a loading dose of anti-VEGF and then running 2 dose arms for our agent compared to a per-label SOC. We'll also be running a mechanistic study. And then finally, I just want to end with our management team. We're excited to be part of the retina community and excited to be here at OIS. We are looking to possibly raise funds in the fall. If anyone's interested, Erin, Esther, and I are in the back of the room. Thanks so much for having us, and happy past your midpoint.